Hi, this is John McMath, and for those of you guys that know me, first off, I have to apologize for not being kind of checked out for the last few months. It's been really bad. I've been basically bedridden, and you can tell I've pretty much lost. I weigh 157 pounds now compared to the 185 that I was when I was working out, and it's just you can't, you can't work out when you're in this kind of pain. So we had our second surgery a couple days ago here at Cedars-Sinai in Los Angeles, and you can see that we had to go back into the glute to pull out some scar tissue on the sciatic nerve, and then also in the hamstring there was a ton of scar tissue there. And I'm very thankful because I found the only person in the world that invented the technology where you can see nerves outside the spinal canal, which is called the MRN, magnetic resonance neurography. And I'm so thankful because if I didn't have that, I would be like most people, having pain management, going to pain psychologists, being on narcotics the rest of my life. And it's just, there's so many people that just don't know about this. And my goal in the next 5 years is to get 1 million people out of pain, and they can. I mean, if you can get the diagnosis, get the picture, then you'll be able to get to somebody like Dr. Filler that can go in and take care of any impingements or anything like that. So I'm just so grateful and so thankful that I was able to be here and do this, and it's going to be a tough road. I mean, I've got a couple, 3 months of rehab and recovery, and then of course we're going to get back in the gym and get what I was and hopefully way beyond. So again, everyone, thanks for hanging with me, thanks for believing in me, and sorry that I haven't replied back. And it's just, when you just hurt this much, you just can't do it. So I'm really looking forward to getting back into life, getting in the game, and really helping a lot of people. So you can see for quality assurance, we're about between 157 and 158, and when I was at my best conditioning about 1.5 years ago, I was 185, and I'm 5.6% body fat. So my body fat is probably gone to 7 or 8% because there's no way you can keep it that low unless you're anorexic without the muscle. But what we'll be able to do once I am able is to just build the muscle back and keep everything there, and get this back up to the 180, 190, and just be solid as a rock and be flexible, dynamic. I mean, more importantly than being muscular, you want your hip flexors, like, you want to be balanced, because the way you're not in pain is to be muscular balanced, your hamstrings and your quads and your back and your chest. And that's what we're really going to be focusing on, is really getting those things aligned, because that's how you stay out of pain. And I'm not talking about like sciatic pain necessarily, just normal aches and pains. It doesn't matter if you're a water skier or any kind of athlete or runner. You got to keep everything balanced and stretched and dynamic, and that, especially as you get older, that's really going to pay dividends for you.